My name is Dayun, and I'm currently a third-year student at Griffith University, and this is our uniform. So for the first question, based on my foundational learning during university, I have been able to use well-developed communication and interpersonal skills to ensure effective patient care is delivered. For example, when I enter the room, I start by introducing myself to the patient and their families, start to build rapport with them, and trust is established. I actively listen and use open-ended questions to gather patients' concerns and validate their feelings, and also ensure that they are involved in their own care. Using nonverbal languages like sitting at their level, eye contacting also ensures that safe and effective care is delivered. I use teach-back method and paraphrasing techniques to confirm the patient's understanding after a medication, education, or care instructions. I try to avoid any medical jargon so that they're not confused during the conversations. For the second questions, if I made a medication error, my priority would be the safety of the patient. If it is an IV medication, I will immediately stop that and start assessing the patient, such as vital signs or DRS-ABC, and any side effects. I would inform the team leader and the medical team and try to find any antidote for the medication. Additionally, I will also complete an incident report and debrief with my peers and the team to prevent further errors. To keep my patients safe during a medication administration, I strictly follow to the 6 rights of medication. I start by checking the patient chart and any allergies they have and alert the team leader if the medication has to be withheld. For example, if digoxin, we have to only administer when the heart rate is over 60. And I do double checking with the nurses for high-risk medications. And I also involve the patients to confirm their understanding and of the medication using teach-back methods. For question 3, when I feel overwhelmed with high acuity of the patient, I always start off the shift by utilizing a time planner. This helps me to consider what to complete during the day and ensure I don't miss any cares out. I prioritize care of the patients from their urgency, but I also ensure that I can spend all the time looking at all of my patients during the shift. However, if I continue to struggle, I seek support from my colleagues, openly communicate with them, and delegate appropriately, and also help the colleagues when possible. For number 4, the National Safety and Quality Health Services standards are essential for delivering safe and effective care. Throughout my nursing journey, I continuously adhere to these core principles during placements, such as medication safety, developing a comprehensive shared care plan, and involve patient in the center of the care, and also effectively communicating to ensure patient safety. Utilizing tools like handovers, protocols, or incident reporting also helps uphold the standards. Adhering to the work health and safety principles means identifying and reporting hazards, ensuring correct manual handling techniques, using personal protective equipment as required to protect me and also the patient. For the final question, one of the positive experience I had during a placement was actually during a mental health ward placement when I cared for an isolated patient after an attempted suicide. Embodying the CHS values of We Are Kind, I used active listening and maintained eye contact to build rapport with the patient. I found out that the patient used to be a musician, but was withdrawn from his hobbies for more than 6 months. I suggested if he wanted to join any musical activities within the ward and play the guitar, respecting his wishes, upholding the We Are Respectful value. By creating a safe and connected environment, the patient began to open up to me and the team, and we were able to delve into the deeper reasons behind this suicide attempt. This was a very positive moment for the patient and me, as it affirmed my commitment to person-centered care and highlight the positive impact of kindness and respect in promoting recovery. Thank you.